Genomic testing in cancer examines the DNA of cancer cells to identify genetic changes and biomarkers, specific molecules or signals linked to the disease and how it mutates. These biomarkers help doctors determine how aggressive the cancer might be and which treatments could work best. Mutations are alterations in the DNA sequence, and they can happen naturally or due to environmental factors. Some mutations drive cancer development by causing uncontrolled cell growth, while others can influence how cancer responds to treatments.
So I'm here at the British Thoracic Oncology Group, or BTOG, meeting in Belfast. This is a very important meeting to us to hear all the latest developments in things that relate to lung cancer.
Lung cancer is leading the way in personalised medicine and personalised care. We understand lung cancer in much more detail than many other tumour types. We understand the genetic landscape of the tumours of lung cancer patients. When we find something abnormal in the tumour, we can give a treatment specifically focused for that cancer. And what we see is when patients are given those, that patients have better outcomes, better responses in the longer term.
There's more and more work. There are more lung cancer patients now than there are before. We're better able to detect these patients early. We have things like lung cancer screening, so there are more of them. And regrettably, there are fewer of me, there are fewer pathologists now than there were. And the work is increasingly complex.
There has been quite a degree of frustration arranging and taking a biopsy to getting a genomic result, and most importantly, starting treatment. There are really unacceptable delays. The UK LCC report, which came out today, there are 12 recommendations in total, but I think the one thing that came across in putting together this report was that everybody who's in the pathway, and there are lots of different people, need to understand what goes on. People who do one part of it, they take the biopsy, or the pathologist in the laboratory who's doing the histochemical or the H&E analysis, and then there's the genomics bit, and they're not really connected. And everybody is working hard to do their bit. We need to make it much more connected.
And each part of that diagnostic process is a hurdle or a barrier to delivering the results, to be able to make a treatment plan. I think it's so important that we really streamline that diagnostic process in the genomic testing.
So when it comes to diagnosis and genomics biomarkers, all parts of the process need to be aligned, because the difference it makes for a patient is absolutely profound. And it can mean the difference between a patient getting life-saving surgery or not, the patient having days or weeks to having months or years or even longer in terms of good quality treatment. What's important is that we get that information in a way which is accurate, in a way which is reliable, and in a way which is quick.
So what we would like to see is the turnaround times for people who are having genomic tests improved to the standard where everybody is enjoying a 14 calendar day turnaround time from the time of their biopsy to the full genomic report. The benefits to the health system mean, of course, that if we have earlier diagnosis of patients, there can be better outcomes for those patients and less of a cost on the system over time.
We should be able to get the results within 14 days so that we can tell a patient what the treatment is going to be, whether that is a targeted treatment or whether it is something else. It's equally important. So it's not just about people with targetable mutations, it's about everybody getting the correct treatment.
And I think if we can get it right in lung cancer, we set an example not only to other tumour types but to the world of how to do high volume genetic testing to deliver personalised cancer treatment to patients.